Roadblocks and challenges. Lack of staffing can cause roadblocks when it comes to a hospital because with the lack of staffing brings back a lack of urgency in hands to administer medication. Lack of staffing brings less eyes and ears on patients, thus bringing larger patient to nurse ratio, brings a larger patient to nurse ratio, and that can cause medication error. This could go from a ranging from 4.5 to 10.8 patients per nurse to 10.8 to 20 patients to to 10 to 20 patients per nurse. A lack of staffing means more waiting time, not only in the lobby, but patients waiting on food, drinks, bathroom, help, and medication administration. You'll have several patients with a 30-minute window where you can give medications, and it's three or four of your total number of patients. This made it difficult to administer all medications on time. Not only can the patients themselves can cause distraction to administration medication, but the patient's family can cause distraction and a challenge. It is not uncommon or out of the question for families of a patient to track down a nurse. A call bell system that is built into most hospitals allows nurses to be called immediately on their phones. Um, Families also frequently get in touch with the primary nurse of a loved one when they have inquiries or when the loved one needs assistance. However, it makes it difficult to maintain an uninterrupted process since patients and their families might not realize how important it is to follow it. Although education can be given, disruptions might still occur. Um, Analysis of the nurse. Nurses can play an important role in hospitals, being patients' advocates and providing majority of patients' care due to being a main person who interacts with patients and their families. There are several barriers nurses face when it comes to medication management and procedures to prevent errors. Nurses must follow the rules set down by the hospital when administering care to include handing out medications. So, what can we do? Well, different hospitals have different protocols and procedures. Therefore, nurses need to follow the guidelines and protocols and procedures to ensure patient safety. As nurses, it's important to make sure to do your six rights of medication administration before administering the medication to ensure patient safety. As well as when given a new order, you always want to read back the order to clarify with your provider that you are giving the correct dosage and the correct medication. And you should never administer medications you don't know. So it is very important to look it up and educate yourself as a nurse. Always ask for allergies. This is due to not all allergies will be listed in a chart. There have been many times when um, the nurse will tell the patient that they're going to administer this medication, and then they say, "Oh, I'm allergic to that. I break out in hives, or I cannot breathe." It could be anaphylaxis, and it's not listed in the chart. So it's always great to ask for allergies. When it comes to dangerous medication like insulin and heparin IV, there's always to have a second check to ensure patient safety, so it's not administered too fast or it is a correct dosage, because we don't want a patient go hypoglycemic or um, having injury or resulting in death. Um, a reflection is first off, as I've gone through my classes and time at Centera OBC, I have learned a few things. First off, working together as a team on the floor and in the hospital makes things work more smoothly. If there are multiple patients that need help, then the team will get together to help cover each room and whatever each patient and family needs. This is not good, not only for the nurses and patients, but for the morale as a whole. Having compassion and patience toward patients help make nursing a bit easier on a long day. and stressful day. The last thing is being prepared. Communicating with other nurses and being thorough can help make sure medication errors don't happen, or at this very least are limited. There's still more to do, I believe, when it comes to preventing medication errors. However, the protocol in place do a good job for now. There is always room for improvement in just about anything.